Hey future doctors, today we are going to see about adaptive disorders. So there are adjustments which the cell makes in the response to the stresses, which may be for the physiological or it may be due to the pathological injury. So if there is decrease or increase in the size, then it is known as atrophy or hypertrophy respectively. And if there is a change in the pathway of phenotypic differentiation, then we can call it as metaplasia and dysplasia. So we are going to see all these things in the different videos, so please do watch. So in this video, we are going to discuss about atrophy. So the reduction in the number of cell or the size of the cell of an organ or its part, which was once normal, it is known as atrophy. So if this was the size of the heart and now it has become like this due to decrease in the cell number as well as size of the organ. So this thing is known as atrophy. So there are various causes which causes the atrophy. So it may occur due to the physiological or pathological causes. So first we will see about physiological atrophy. So in the physiological atrophy, here the atrophy is a normal process of aging in some tissues which could be due to the loss of endocrine stimulation of the arteriosclerosis. So here examples are atrophy of lymphoid tissue with the age, or atrophy of a thymus in the adult life, or atrophy of gonads after menopause, or atrophy of brain with the aging. So these are some examples of the physiological atrophy. So with time, these things occur. There will be change in lymphoid tissue, there will be change in thymus, as well as with the gonad and brain also. So now we are going to see about pathologic atrophy. So there are various causes of the pathologic atrophy. So first is starvation atrophy. So in this starvation, there will be a depletion of the carbs as well as fat, which is followed by the protein catabolism. And this may cause weakness, emaciation, as well as anemia, which is referred to as cachexia, which is seen in cancer, as well as severely ill patients. So next is ischemic atrophy. So in this case, there will be atherosclerosis, which may result in the shrinkage of the affected organ. So in this case, there will be atherosclerosis of the renal artery, then atrophy of the brain in the cerebral atherosclerosis. So these are the example of ischemic atrophy. Then next is disuse atrophy. So in the case of disuse atrophy, if we have not used some organ for a prolonged time, they have diminished functional activity. For example, wasting of muscle of limb, which are immobilized in the cast. For example, if you have applied a plaster on the hand, and if you have not mobilized it for a long time, functional activity of the hand, it may get diminished. The next example is atrophy of a pancreas in the obstruction of pancreatic duct. So these are some examples of disuse atrophy. Now we are going to see about neuropathic atrophy. In this, there will be interruption in the nerve supply which will be leading to the wasting of muscles. For example, poliomyelitis, motor neuron disease or nerve section. Then next is endocrine atrophy. Here there will be loss in the regulatory mechanism which will reduce the metabolic activity of tissues and hence there will be atrophy. For example, there will be a hypopituitarism which may lead to the atrophy of thyroid as well as adrenal and gonads. The next example is hypothyroidism. In this, there will be atrophy of skin. The next is pressure atrophy. Here, if the prolonged pressure is applied from the tumor or cyst, it may cause compression or atrophy of the tissues. For example, if there is erosion of spine by the tumor in the nerve root, then erosion of skull by meningioma arising from the pia arachnoid, then erosion of sternum by the aneurysm of the arc of aorta. So these are some examples of the pressure atrophy. Now next is idiopathic atrophy. So there are some example of atrophy where no obvious cause is present. For example, in myopathies, in this there is no obvious cause, then also there will be atrophy. Then testicular atrophy. So these both are example of idiopathic atrophy. Now we will be going to see about morphological features of atrophy. So here the organ size is small as well as it is shrunken. Cells become small but they are not dead. Then shrinkage in the cell size is due to the reduction in the cell organelle as well as mitochondria, myofilaments and endoplasmic reticulum. So these are some chief organs due to which atrophy occur. Then the increase in the autophagic vacuoles which contain the cell debris. This can also lead to atrophy. Here examples are lipofuscin pigment granule in the brown atrophy. So this was all about atrophy.